We see really striking racial differences in access to quality care. Even though racial minorities, African Americans and Hispanics tend to live more in urban areas, there are still lots of challenges with accessing the care that's available.
So unfortunately, what we're seeing clinically is that the disparity between our white patients and our non-white patients is widening. And this is being evaluated by Dr. Tomi Akinyemiju's team, and it's something that requires urgent attention.
So we are working on it's a 7-year grant funded by the National Institute of Health, doing a deep dive and looking comprehensively at first defining healthcare access. What does that mean for cancer patients? There are 5 domains. So the affordability, which is the cost; availability, which is there a cancer center around where you live that you could get to; accessibility, so the transportation, do you have to drive and how many hours will it take you to get there; the accommodation, which is the convenience, hours of operation, locations, needing childcare; and then the acceptability, and that's the patient-provider interaction. We hear a lot from patients feeling like there's a lack of empathy, less than optimal communication between the patient and the provider and the providing team.
One of the hardest things as a physician, where you know a patient has a curable cancer and a preventable cancer sometimes, and because she doesn't have access or she doesn't trust the system, she won't come in regularly.
Many times whenever we are there for a treatment and you look around and you can tell the people that have no one. And I have no idea how they maneuver, how they even get their medication.
Then we're studying how each of those domains individually and how all 5 jointly impact the quality of treatment after ovarian cancer diagnosis, how it impacts survival outcomes. And we selected states that represent geographic diversities, all the way from Kentucky, California, Texas, North Carolina. We had conversations with cancer survivors and asked them, what was your experience like? What was the barriers? What did you experience? How did that make you feel? And we used that to guide our main study.
So once we understand what are the biggest barriers, how do we overcome them? And I think her data will really illuminate kind of those biggest factors, and then we can design prospective interventional studies to overcome those obstacles that patients are facing.
So we're hoping that our findings will help make the case for organizations to think about this, create metrics to measure how you're doing on each of those 5 domains. At the organizational level, there are things that institutions can do. Simple things like think about parking, thinking about bus lines, thinking about hours of operations, where to locate clinics. All these other dimensions that we really need to think about moves us away from the simplistic view of thinking about access as, just give somebody insurance, right? It's more than that.